Assalamu alaikum warahmatullahi wabarakatuh. Welcome to another episode of Agahi, a show based on mental health and psychological well-being with your host, Waritha Zainal. Today's episode is going to be a pretty interesting one because today we are going to talk about issues like Jinn Possession, evil eye, and black magic, and how people often confuse these things with mental health related disorders. To understand further what is the difference between mental health illnesses and things like Jinn Possession or evil eye and black magic, we have invited Dr. Rasjid Skinner, who is a clinical psychologist and a professor and has been doing a lot of work in this field for a very long time. Dr. Rasjid Skinner, welcome to Agahi.
Assalamu alaikum.
Wa alaikum assalam. So happy to have you.
We're delighted to be here. Yes, it should be an interesting discussion.
Yes, really looking forward to this. And I'm sure you are more aware than I am, of course, about the mindsets of the people in our community and how often people resort to things when they see a family member or a loved one showing certain symptoms like losing contact with reality, hearing things, seeing things, confusing hallucinations or delusions with things like Jinn Possession. So please, we would like to hear your thoughts.
Well, first of all, we run in the UK Exam, which is a psychological therapy service which is based on Islamic psychology. And the vast majority of our clients that come to us for treatment don't necessarily attribute their symptoms to the occult. By occult, I mean jinn interference, jinn possession, evil eye, black magic. There may be concerns about it. So one thing is that we need to address those concerns because the thought that your symptoms might be due to a jinn or something like that is itself a psychological fact. So it's something in your head, the thought about it. And we use a reliable Ruqyah. So if somebody's got that suspicion, we don't just say it's ridiculous, because actually as Muslims, we know these things exist.
Yes.
So they can't be just discounted. The issue is this necessarily so in that person's case? And even if it is it a factor in the mental illness or the mental distress they're going through?
Right.
So you have to start by being able to discuss these things sensibly within an Islamic tradition. I'm a psychologist, so I'm not an expert in things like jinn and so on. Though we might discuss later how I might make a diagnosis between something that is related to things like jinn and things that are not. But we work with a reliable Ruqyah. This is somebody we trust that's only going to use sound Quranic forms of Ruqyah.
Yeah.
And he will give us a view on whether there is something there of that nature or whether it's not.
Mm-hmm.
Even if it is, it doesn't necessarily mean that this is the major factor in that person's problem. So things are often mixed, and if there is a occult influence, then it may be relatively minor.
Right.
And if it's there at all, we let the Ruqyah deal with it, and we deal with the psychological aspects of it. Even if the person thinks, this is, there's no doubt about it, I'm feeling like this because of black magic or something like that. If you had a car accident because of evil eye, let's say, you wouldn't be screaming on the ground with a broken hip, calling for the Ruqyah.
Yeah.
You'd want the ambulance, wouldn't you? And you want to get into hospital quickly and see a surgeon and get the hip dealt with. So even if you think that the cause of something is that, you still need to treat the symptoms.
Yeah.
And if that is the cause, then that's the job for the Raqi. Does that make sense?
If you may please explain to our viewers, because maybe there are some people watching right now who are not familiar with the term Ruqyah or Raqi. So if you could please.
Right. You probably know more than I do, actually, but in effect, Ruqyah is normally understood to be treatment through verses in the Quran. And the Raqi is the person that does that, who specializes in it. Not by recitation of the Quran, maybe some prophetic dua, prayers. We know there are other practices that go on within different Muslim traditions, but some of these are, I think, rather unsafe. So we stick to our Raqi does with prophetic dua, and particularly Quranic verses, and some in particular, and based on the hadith. And we should remember that the Quran is shifa for all sorts of things. I mean, the hadith is that one of the reliable ones about Ruqyah is about a scorpion bite. You can use the Quran to get good sleep, so all sorts of things. There was a very interesting study done by the American psychologist Carrie York that showed Quranic Ruqyah working on non-Muslims with complicated psychosomatic problems. So there's a real objective healing power in the Quran, which you can use for all sorts of things. It's not just for dealing with issues around black magic or jinn or evil eye, but it can be used for that. So that's Ruqyah, and the Raqi is the person that does it.
Thank you. Thank you for that explanation. So in your clinical practice, and mashallah, you've been practicing for a very long time, has there ever...
Yes, too long, I think. Yes, carry on.
Has there ever been a time when you came across a patient, a client, who showed symptoms of, say, for example, psychosis, but they were under the impression that it's something else?
That's, I think, quite common. I have only once come across a case where I thought it actually was something jinny occurring. It might be worthwhile talking about these different things. There's no doubt from a Muslim point of view that jinn exists. That is, there is an invisible order of creation, and they sometimes interfere in the affairs of mankind, for good or bad. And I think every culture around the world has a belief and stories about this, including England. The stories about fairies and fairy godmothers and gnomes and imps and so on. So that's fairly clear. And there's no doubt they exist. If you ask an audience of non-Muslims, people who don't think much about these things, and say, who's had an experience of things going bump in the night, something eerie happening, something you can't explain, the sense of something invisible, most people will say yes. And I also, I'm often in the English countryside, and I used to breed sheep, and I know there are certain trees where jinn live, and one actually stamped my toe the other week. So, this exists, and it's a different world to ours. We treat it with respect. The issue is, can jinn actually possess somebody? Mm-hmm. We know that it is possible to cause a disturbance in people's lives. Can they possess? And Muslims haven't had a consensus about this. So we know Ibn Taymiyyah, for instance, wrote a whole book on jinn possession. But there were people like Razi, for instance, the most famous of the Arab physicians, who said possession wasn't possible. I don't recollect Al-Ghazali ever mentioning it. So jinn exist without doubt. They interfere in our lives, and sometimes I think can affect mental state. Whether they can actually possess somebody or not, I don't know, is my answer. I can say it is possible, But in clinical practice, I've only come across one example, and it wasn't actually a patient, where I thought there was definitely something around Jinn that was influencing mental state. And one reason I would use in the diagnosing this is whether there are objective signs. In this case, the temperature in the room got suddenly very cold to the point I was shivering.
Wow.
And the person's face changed and they became paranoid. And this might last for less than 5 minutes. Temperature would go up, person's perfectly normal. It went on for about an hour and a half. So now whether that's possession or I don't know, but there's some influence there. And we thought afterwards it was probably to do with black magic. So it's possible, but in most cases, I can't see that influence. I can provide a psychological explanation for why people are having the symptoms they're doing. But as I said earlier, the person still needs to be assured of that, because it's natural as Muslims, we would say if something odd is happening to us, then it could be any of these other things. So thus we use the Ruqyah. Ruqyah can come back, say, no, there's nothing there, or there's something there, but it's not that important, and I've dealt with it.
Right.
But this is important. If you set up a service where you're going to give the impression you completely discount the possibility of anything of that nature, then people aren't going to come to you, or they're not going to be honest about what their thoughts are. And you do need to bear it in mind as a factor. In other things, marital disputes. I dealt with one couple that had clearly disturbed something in a house in India. Things were flying about the room, fires breaking out, and they had furious arguments. And they came back to England, and if it was, followed them. This is before Priti Patel had introduced more stringent visa restrictions, and I could hear it. I could hear the funny voices coming out of the wall and so on. We dealt with it. It wasn't possession. It was that there was something there. Something was affecting mental state, in the sense they were arguing and in ways they wouldn't have done before. So these things are factors. We also need to be remembered that worldwide, as far as serious psychosis go, the belief in Jinn possession normally gives a better prognosis. So even if something's wrong, it may still be beneficial in some cases. And this is because we don't know why, but it may be that the way society treats people that are hearing voices, that is different. I keep an open mind, so I don't discount these possibilities. I would take a view on whether I think there is an influence of that sort, and as part of a comprehensive treatment, just as I would get somebody to treat a physical disorder that I discovered in the examination, I would get somebody to deal with that side of things.
So, the Muslim religious beliefs, they have an impact on mental health of individuals and families and communities, and especially when people are unable to understand and comprehend certain symptoms, whether it's hallucinations or delusions, or even things, disorders like schizophrenia, for example, and there are so many types of schizophrenia. Similarly with multiple personality disorder, where we've seen people speaking a foreign language, a language they have never learned before, a language they haven't actually taken classes for, and they're speaking fluently. So these things are, and for an average person, it's difficult to comprehend and understand why this is happening, what's causing it, what is the root factor. So they may jump into conclusions, they may blame certain things or paranormal activities, instead of going to a mental health professional as the first point of contact for these symptoms?
Well, steady on. The evidence is if you go to the mental health professional and a psychiatrist, the first point of contact, your prognosis is going to be worse. And if you go to the local spiritualist, there's an interesting German anthropologist, Dr. Wax, who was doing research in India in Hindu shrines for dealing with mental illness, which the Indian Psychiatric Association was trying to close down. And he was an expert witness in court because he said the results obtained at these Hindu shrines were better than Indian psychiatrists. So psychiatrists, in a way, also don't understand these phenomena. Most psychiatry, as opposed to psychology, but psychiatry, medical psychiatry, is what's known as phenomenological. It deals with symptoms.
Yeah.
By and large, not with causes. Now, that's important. I mean, if you've really got two entirely different and not incompatible ways of dealing with the same phenomena. The psychiatrist is saying, this is called schizophrenia because you're hearing voices and you've got these delusions. The presumption is it's something to do with the brain biochemistry. But you could equally say, yes, but it's the jinn that's caused the biochemistry to go out of sync, or it's black magic or something.
Yeah.
The point is getting people to accept what treatment is available that is like to be effective. So if there is psychiatric medication that is going to stop people having dangerous paranoid delusions, then you need to get people to take that without necessarily saying this is due to A or B or C. And we did have at the hospital I worked at something called the Jinn Project. At the time we had a lot of young men, probably cannabis psychoses, whose families weren't accepting that. Saying, oh no, it's due to jinn or black magic or something. So for a year, we had a research grant. We used an imam that dealt with that, and the psychiatrist dealt with the symptoms.
Right.
So just as I said, if you had a road traffic accident, and even if you thought that was due to black magic, what you'd want is somebody to deal with the symptoms of that. You'd want the ambulance to come, take you to hospital and have the hip repaired. You wouldn't, as your first thought, be screaming out for the Raki.
Of course.
So we can sort of split these things, say, well, maybe it is, I don't know, go and see the Raki, but you've got these symptoms, this is the medicine that's going to work. With psychological matters, which is mostly what I deal with, normally you can see the cause for something. And here you get, I think, more obvious dysfunctionality if you're believing everything is due to these occult influences. Because instead of facing up to the problem, there's a family problem, there's real bad things going on in the family, or, there are tensions and conflicts that need sorting out, or there's been child abuse in the background, or whatever it is, people avoid it by spending, often large sums of money, going to see Rakas that will take the money, or whoever it is. That's more obviously dysfunctional. So this is an issue that we need to perhaps be able to educate people to understand that there is an Islamic psychology. There's always has been. We go back to al-Baqi and al-Kindi and Ghazali, Ibn Sina, an understanding of mental conditions, what causes them and how we treat them. And we've been developing that in recent years. So there are effective Islamically sound treatments and diagnoses for these conditions, without rubbishing the fact that you would also, as part of the diagnosis, consider those things. And if they're not there, people know, or should have at least the confidence of knowing, no, it's something psychological, and that's the route I've got to explore. That makes sense.
Yes, I was just wondering, like you give an example, if God forbid someone had an accident and they broke a limb or fractured a bone, they wouldn't be calling out for a Rafi, right? Surely there is a way to diagnose the injury that has been caused by the accident, for example, an X-ray or a CT scan to figure out what actually is the problem so that it can be resolved accordingly. So when it comes to mental health illnesses, when it comes to psychological disorders, are there any tests available, or do psychologists or therapists carry out some kind of psychometric testing to find the right, intervention, and also what the actual diagnosis is?
The simple answer is no, but a good psychologist wouldn't. I mean, there was some saying about the psychometric test in the 50s and 60s, but I think nobody in the UK would do that now. You would make the diagnosis from understanding, and particularly if you're working from an Islamic model, so your understanding of the aql, the understanding of the qalb, the understanding of the different forces in often called the hawa, the appetites, the nafs in common parlance. And you're working out how these things are functioning in relation to each other, and whether they're in balance, whether they're not in balance. And if they're not in balance, you can work through the history as to what's causing that to happen. So you'd make the diagnosis that way. And I say, not excluding the possibility there might be some occult influence in all of that. Just our experience is it is seldom a major factor if it's there at all, but you don't exclude it. It's part of all the things that you're looking at. And so you begin to understand what it is that has pushed the person out of balance, if they are out of balance, because we have a situation now where society itself, particularly in the West, is itself out of balance. Is no longer operating accord with fitra, and what is natural. So somebody may actually be in accord with their fitra, but having problems because the society around them isn't in accord with that fitra. And this can apply to Muslim families. People can be overtly very Muslim, but actually in the way they run their family lives, they're not doing it in a very Islamic way. You've got to bear that in mind for diagnosis. In a sense, the person hasn't got the problem, the society around them has, the family has. But explaining that helps the person deal with it. So it's not a matter of giving a test or anything like an X-ray. It's more complex, more subtle, more meaningful. With psychiatry, dealing with serious mental illnesses, we know some, like bipolar disorder, are almost certainly largely biochemical. And so the principal treatment would be biochemical. We've still got to deal with psychological aspects of that, what might trigger it and how the person copes with it. With what's lumped to schizophrenia, this is very messy. I mean, there are certainly biochemical correlates of that. In other words, there are things going on in the brain that relate to hearing voices and things like that. But it's it's a complicated area. I mean, one interesting thing is that schizophrenia doesn't seem to be observed anywhere in the world until the mid-18th century. Now, the Greeks and the early Arabs are diagnosed bipolar disorder, deep depression, obsessive compulsive disorder, anxiety, panic, but nobody seems to describe what would now be regarded as schizophrenia. And there's different theories as to why that is. But it may be that things that are actually not necessarily a problem have become a problem because of changes in society, for instance.
Right.
So this is a complicated area. And
I mean, there are, I've heard of this emerging field of parapsychology, and
yes,
how you have people who carry out research in paranormal activities that science may be able to justify to some extent by using certain tools to monitor. For example, the example that you gave just now about this client, where the temperature of the room suddenly dropped and it became really cold, and they have
yeah.
these tools that can actually measure the temperature of the surrounding and why it suddenly dropped, and even the human body, where it suddenly become really cold, where there's some suddenly really warm without any apparent reason in the environment. And they can actually sense movements, vibrations, sounds that an average human being is unable to detect, but they have tools and machines to do that for them. So I think we are coming across many researchers now in the field of parapsychology, which is totally different from obviously what you have been practicing all your life. But
but I accept it. I would say, as Muslims, we don't need those machines. We know jinn exist. You know, they're up in the trees. They're going about their business. Sometimes they interfere with their lives. Well, that's it. You know, that's the jinn world. We know that it exists. There's different areas of phenomena, like the true dream. I mean, genuine spiritual experiences, which are a completely different level, but which again you need to include in understanding, you know, the condition of the person. Some people can have what might be a very deep spiritual experience and find it frightening, for instance. So there are different levels of the unseen going on, I suppose.
Yes, I mean, like you give an example of this couple who were seeing flying objects in the house or things moving around. We get to hear these stories all the time from people, but so they do exist.
The issue is not whether the things are true, they are, and they do have an influence on mental health. You can almost talk about a a sort of post-possession trauma, or at least, you know, if you've been disturbed by these things, then this has a psychological effect on you. So it's just that I've never actually come across a case where, and these things may be disturbing to people, it causes rows in families, it may affect people's functioning in daily life to some degree, but I've never come across a case which of psychological disturbance that I could entirely explain by reference to those sort of occult forces. But they may be there. We can all pick up evil eye, for instance. So if there's something else going on in our life, which is a stress, that adds to the stress.
Yes.
And if you're treating somebody holistically, you deal with that as well as everything else.
Of course, of course. So this reminds me of something really interesting. At one point, it was in the news, on the television, the case of Emily Rose. I'm not sure if you're familiar with that.
Yeah. Is it multiple personality?
And it was associated with demonic possession, and
yes.
they had to ask a priest to intervene because the strength of Emily became so intense that she could actually float in the air and raise herself and move around furniture, cause power failure in the house. So there were things happening around in the environment that everybody else was being affected by. So we do have some interesting cases in history that people, associated with possession.
Yes, I'm inclined to take the view it can occasionally happen. One of the signs being also objective phenomena. So things like levitating,
Yes.
or things like things flying about the room, for instance, that are associated with it. But a lot of things that people typically assume to be possession, I don't necessarily think are. For instance, incredible strength. Well, actually, the body is capable of doing extraordinary things. I was once being chased by a bull, and I've never run so fast in my life. And I jumped over a 7-foot hedge.
Wow.
Well, I could never do that normally, but the body's capable of it in certain circumstances. Speaking in strange voices doesn't interest me, and particularly if there's a cultural idea of what possession involves.
Yes.
So, for instance, I know in Pakistani culture, it's if women are possessed, they're expected to speak in a deep, male, eerie voice, often, saying obscenities in Urdu. Well, people can do that subconsciously. There was in modern terms, a dissociationist disorder. In old money, it was called conversion hysteria, where people, not consciously but unconsciously, could produce all manner of symptoms. An example being shell shock in the First World War, where people would have epileptic fits, would go blind, would go paralyzed because it pins in them and they wouldn't feel it. All this is produced psychologically. So these things don't convince me. And I would always look, has somebody got a gain for having those symptoms? And one gain is you get a lot of attention. So I'd be looking at, without totally dismissing it, would be saying, but however odd and however weird it is, even however scary it is, unless there are those very clear objective things, including the temperature clearly rising and falling, for instance, I would say it could all be psychological, but I've got to find the reasons for it. Is somebody in that family so deprived of attention that this is unconsciously being created? Or they're so angry at something but can't express the anger in any other way. I mean, I had a case a long time ago where a woman had a mother-in-law staying with her and became possessed and swore at her mother-in-law in obscene language and started throwing things at her. The mother-in-law ran out the house. Well, it worked. I'm sure the woman was doing it completely unconsciously. But and once the mother had gone, the possession stopped.
Wow, that's interesting.
Interesting. Though interestingly, they did go to Iraqi, and the Iraqis said, it was a long time ago, but the Iraqis said, yes, the mother-in-law had a jinn with her. The jinn had always liked the mother. The jinn was in love with the mother-in-law. Anyway, and he followed her across from India or somewhere, and he didn't like the mother-in-law, so he'd caused the possession. So the best thing was that the mother-in-law didn't come to that daughter-in-law's house any longer. So perfect family therapy, everything sorted. So the fact that you get very bizarre things happening, which everybody's going to say, that's possession, isn't necessarily. But it may serve a function. And if they're coming to the psychologist, so they could be, but you're also looking at, but they could also be psychologically produced, but there'd be a reason for it. So what's the reason? Can you find the reason? And if you can find the reason, you sort it out in another way.
Now, in certain cultures, like in Pakistan, in India, Bangladesh, and many other parts of the world, apart from Jinn possession, there's another belief, which is commonly held amongst people, is that black magic can cause behavioral change. Black magic can change family life circumstances, deprive somebody of their good health, finances, or simply peace in life.
Yeah.
And these countries are full of scammers who charge thousands and thousands by these innocent people, from these innocent people who strongly and genuinely believe that the reason they are suffering in life, for whatever reasons, the blame goes to people who practice, black magic, for example.
Yeah.
So what are your thoughts on that? Because I know that you do teach in Pakistan as well, and mashallah, you've been, teaching for a long time, and you've had that exposure. Any interesting cases or scenarios you would like to share?
Well, certainly black magic exists. I don't think as a Muslim you would doubt it.
Yeah.
I think there are very, very few Muslims, some Mu'tazilites doubt it, but my experience anyway is that it exists. So it's a factor you bear in mind in making the diagnosis. The problem is when you've only got one explanation for things, and the situation you're describing is that. It's the only explanation is black magic. Therefore, I go to the person who says they can deal with it, who's almost certainly going to say it's the sister-in-law, and you end up with, major family problems coming from it. So you've got to bear it in mind as a diagnostic possibility. Even if it's there, you've got to take a view on, is this 100% of the problem or it's only 5% of the problem? So we come down again to having, really, we should have our own sort of comprehensive, organic Islamic psychological services that are going to take account, not just as most Western psychiatry and psychology does, just with surface symptoms and maybe the way people think and people's emotions, but also look at the spiritual side of people and also look at these other possibilities, as well as also things like diet and that sort of thing, which is all part of the diagnostic mix. So it's not saying these things are impossible, it's just saying it's unlikely as a major effect, and you've got to have a complete diagnosis that is going to include that along with anything else. And then also people have confidence. It's in their mind that this is a result of black magic. And they go to a Western trained person, whether they're Muslim or not, who's just working within that system. They probably weren't going to mention it, or if it is, it's going to be rubbish. And it's still going to stay at the back of the mind.
Yes.
I think it is that, whatever they're saying. So people have to have the confidence that you've made a complete diagnosis of everything. And there are ways of telling this. One way is you do use a reliable Ruqyah. You can recite certain texts and find out from the reaction, whether this is likely to be the case or not. And the Ruqyah we uses a mixture of texts and random Arabic as well as Quranic text. So people that are reacting to the random Arabic, probably aren't affected by anything.
Yeah.
So
I think there is a dire need in our community to have organizations where people can seek professional help and advice if they are going through a difficult period in their life, or they're experiencing any kind of mental health difficulty. Where, say, for example, there are professionals like psychologists, therapists, counselors, as well as Islamic scholars, raqis, who can sit together and take a holistic approach to provide the right...
And hakims.
That's a good
hakims are very important. You've got to take account of the body aspects of things as well, and particularly diet. So you have to bring the hakim in, or preferably a traditional hakim. Somebody that practices traditional herbal medicine, but use whatever. Even if you use a conventional Western trained doctor, you need to bring that in as well. You can't exclude the physical aspect. You can get, apparently quite disturbed psychological states from the effects of purely physical illness or dietary deficiencies.
Definitely.
So,
Definitely. And one of the unfortunate things are, like you gave an example earlier on, that sometimes, for example, psychiatrists, they would just look at the present symptoms and prescribe medications. But there is a very common trend in the UK, and I've heard this from a lot of young people, that they have approached their GP, their local GP, when they were experiencing anxiety or even mild depression. And straight away, the GP has prescribed an antidepressant or anxiolytic, or going to a psychiatrist, for example, and they're straight away given antipsychotics.
Yeah.
Without spending enough time to find out the root cause, taking proper detailed history of the client or the patient, finding out what's going on in this person's life or what they have been through in their past. And like you mentioned, diet, what they're eating, what they're consuming. So instead of having a holistic approach and providing the best treatment intervention, straight away, they'll just prescribe medications. And people often get addicted. They get dependent on drugs, which is not a solution, but it can lead to multiple problems.